All right, let's get started. Thank you for joining us today, and we are first going to start off by talking about clinical dietitians. What is a clinical dietitian? Clinical dietitians are nutrition experts who provide patient care. When I say nutrition experts, this basically means that they have gone through lots of schooling and training, like the dietetic internship. They've passed the registered dietitian nutritionist exam, and they are credentialed by the Commission on Dietetic Registration. We will be talking about a lot of these things later on in this presentation and in this course, but basically all you need to know is that they are nutrition experts who help provide this amazing patient care to people in hospitals or clinical settings. So like I just mentioned, clinical dietitians often work in hospital and clinical settings. Clinical settings might include places like outpatient centers, diabetes clinics, long-term care facilities, and more. Clinical dietitians work in multidisciplinary teams. So often in these hospitals and clinical settings, dietitians work alongside people like doctors, nurses, physical therapists, speech therapists, and pharmacists. So all of these people work together to provide optimal and individualized patient care, and dietitians play a significant role in these teams. They work together to create and provide treatment plans for each individual patient in the hospital. Clinical dietitians also help recovery and treating chronic and acute illness. We'll be talking about some of the common conditions that they work with and patients and types of patients, but they often help with these types of things in the hospital. What do clinical dietitians do? They conduct nutrition assessments in the hospitals and clinical settings. And a lot of these nutrition assessments include gathering information like weight, height, BMI, eating habits, doctor diagnosis, and then what they do is they make a plan to help the patient with a nutrition intervention. They also provide nutrition education. So, depending on the doctor's diagnosis that they give to the patient, a dietitian might come into the room and teach about certain things like diabetes, they might teach about heart healthy diets, they might talk about fiber-rich foods and supplements like vitamins, minerals, and protein supplements. Clinical dietitians also work with doctors and nurses. Like I mentioned earlier, with the multidisciplinary teams and all of those team members in the hospitals that work together to provide optimized patient care, dietitians often work alongside these doctors and nurses to help provide incredible patient care. Clinical dietitians also teach about diets to patients and families. So, like I mentioned earlier about providing nutrition education, if the patient is unable to receive certain education or absorb the knowledge that the dietitian is sharing, they might teach about some of those topics to their families and family members who are in the room with them. They also write patient chart notes. Patient chart notes have all of the pertinent information on the patient's progress and diagnosis while in the hospital. And so dietitians will write their own notes and monitor the patient's progress and what the dietitian is doing as far as intervention goes, so that the multidisciplinary team can see what's going on with the patient and how they can best help them. Clinical dietitians also recommend nutrition supplements. And when I say nutrition supplements, this often means like a protein drink, such as a Boost, or they might also order vitamins and minerals depending on the patient's needs. Another thing that clinical dietitians do are order tube feeds. So if there's a patient in the hospital who is unable to eat food orally, the dietitian can calculate the patient's calorie needs, protein needs, carbohydrate needs, fiber needs, and they calculate all of this and then they order a tube feed. I have a picture up here on the upper right-hand corner of what a tube feed looks like. And basically, it's a bag or a bottle that contains a specialized formula with the patient's needs that the dietitian has calculated. And it is inserted either into the nose of the patient and the tube travels down into their stomach, or the tube is inserted directly into their stomach. So dietitians play a big role in this by calculating the patient's nutrition needs. They also monitor patient progress. So as they continually write patient chart notes on the updates and progress of the patient, they often will go into the patient's room and ask the patient how they've been doing and talk to them about their progress. And then they continue to adapt or change their intervention depending on what the patient needs. Now we're going to be talking about some of the common conditions that clinical dietitians work with. So the first one we're going to be talking about is diabetes. People who come into the hospital with a new diabetes diagnosis are often connected with a dietitian so that the dietitian can come into the room and teach about blood glucose or the blood sugar and how that changes with their eating. And with that, they might teach about carbohydrate counting or what carbohydrate containing foods are, and how to create more balanced meals by including protein and fats with their meals so that their blood glucose doesn't raise as fast. Clinical dietitians might also teach how to dose insulin if they have an insulin pump, or if they do it manually, they might teach the patient how to calculate and administer that insulin when they need. Another common condition is GI issues or gastrointestinal issues. So, like I mentioned earlier with tube feeds, that's also called enteral nutrition. I have a picture below of an example of a formula that a patient might be hooked up to via a tube. So, the dietitian writes tube feed orders for these patients, and they choose the specialized formula or calculate it themselves. And then they also calculate the rate or how fast the patient is receiving that formula and how often. People with issues often are unable or have difficulty with eating orally or eating foods by mouth. So the dietitian will help calculate this formula so that they can receive nutrition through a tube directly into their stomach or intestines. Clinical dietitians also often work with people with kidney disease. And so there are certain nutrients that are really important with kidney disease patients, and that might include sodium, phosphorus, potassium. Protein and fluid intake is also really important. So the dietitian will come into the room and teach about all of these things and how to monitor it for the patient. Clinical dietitians might also track what the patient's eating and ordering through room service while in the hospital so that they can help teach them with examples. Some more common conditions that clinical dietitians work with are new food allergies and intolerances. For example, if a patient comes into the hospital saying that they are uncomfortable and their stomach hurts every single time they eat gluten, they might receive a gluten intolerance or allergy diagnosis. And so the dietitian will help teach about cross-contamination and what that means by preparing foods on separate cutting boards and being safe about not cross-contaminating foods with gluten versus foods without gluten. They might also offer substitutions for allergies. So a dietitian might come into a patient's room and teach about certain things to get at the grocery store in place of gluten. They also teach on certain foods to avoid. So patients might not know certain foods that contain the common allergen that they are diagnosed with. And so clinical dietitians can educate which foods to avoid eating and shopping for at the grocery store. Another common condition is heart disease. And so people at high risk for cardiovascular disease can receive help from a dietitian through nutrition education about heart healthy foods and nutrients that are important for this heart health. They might teach about low sodium food options, this heart healthy diet, and how to grocery shop and shop for specific foods. Malnutrition is another important one. So people who are either unable to receive enough nutrition by eating foods, or if they don't absorb nutrients like they should, they become malnourished or deficient in certain nutrients. And so the dietitian helps provide adequate nutrition while in the hospital, whether that's through a tube feed or offering protein drinks or helping them order through room service to create balanced meals that will nourish their bodies. Like I mentioned earlier, they might calculate these tube feeds, offer protein drinks, and then they just teach about calories and nutrients for these malnourished patients. Critical care patients is another population that clinical dietitians often work with. And these are often patients in the intensive care unit for various conditions like major burns, accidents, or other severe injuries. A lot of these patients might need tube feeds if they are on a ventilator or have other needs. So the dietitian will often calculate these tube feeds and formulas and their rate. Critical care patients are being monitored daily, hourly, really often to monitor their weight and other blood work. So the dietitian will often look at other chart notes from people in the multidisciplinary team or look at their lab work to see if their intervention needs to change or if they need to offer certain vitamins or minerals that they're deficient in. With the critical care patients, the multidisciplinary team is all hands on deck. So the dietitian works very closely with the care team to offer this personalized and individualized care. Cancer patients is another common one. Cancer is a very common condition in hospitals, and so they have specialized dietitians who work with these cancer patients and just making sure that the patients are eating enough calories and protein. They help assess for malnutrition, they monitor their weight and their labs, and just make sure that they're getting the nourishment that they need. And with cancer comes a lot of side effects. So the dietitians will often help teach about certain foods or things to eat to help foods taste better, as that can be a common side effect of cancer. Clinical dietitians also work with surgery patients, so they often help with the recovery side. So if a person is admitted to the hospital for a specific surgery, most likely that a clinical dietitian will help them post surgery while they're in their recovery phase to make sure that they're getting enough protein and the nutrients that they need for optimal recovery. So they might recommend some of these protein drinks to help them recover along with their room service meals. They might order vitamins and minerals through the pharmacist that the nurses and doctors then administer to the patient. These are some common settings where clinical dietitians might work. We have talked a lot about hospital settings. They also work in outpatient clinics where a dietitian might have a separate office where clients and individuals can then make an appointment with a clinical dietitian to meet one-on-one, whether that's about weight loss or they have a new diabetes diagnosis and are wanting to get further help after they have left the hospital. So these outpatient clinics are really, really common for clinical dietitians to work. They also can work in assisted living centers or long-term care facilities where people like the elderly might need extra one-on-one care and nutrition advice. And so dietitians will often work here to make sure that these patients and individuals are getting the care and nourishment that they need through food. Clinical dietitians can also work in rehabilitation centers. And so often these are where individuals, after um, an incident or after a hospital stay, need extra physical therapy and rehabilitation. So the dietitian can help offer more of that nutrition advice and education to help them recover and gain back that muscle strength. This is kind of an overview of how you become a clinical dietitian. And we'll be going more in depth about this in a later module in the course, but here's a basic outline of how to become a clinical dietitian. So after receiving your bachelor's degree, you then go on to receive a master's degree. After the master's degree, you complete a dietetic internship where you have all these different rotations and hours of participating and working with dietitians in various settings. Then you are eligible to pass the registered dietitian nutritionist exam. And once you pass that exam, you are able to become licensed in state. And that varies across many states. So just depending what state you're living in, you can look up the requirements for that and become licensed in that state. You can then specialize in something like critical care or other areas within the clinical field. So with this specialization, this is just a way to further your career path and advance in your career. And so a CNSC is a specialized license that clinical dietitians can obtain, and it focuses on these critical care patients and calculating tube feeds. So they learn a lot extra just to become further experts in calculating tube feeds and helping these specific patients out. And that is the end of our clinical dietitian presentation. We hope you enjoyed, and we're excited to see you in the next one.